thousands of people in the UK get a cataract operation to treat blurry vision, replacing the lens in their eye with an artificial version. But recently, there's been a huge change in who delivers that work. Before the pandemic, under a quarter of cataract operations in England, funded by the NHS, were carried out by the private sector. Today, it's more than half. This boom in private provision has allowed almost 200,000 additional operations a year.
Actually, what we've seen in ophthalmology over the last couple of years is a really interesting success story. It's now the only specialty where the average waiting time is less than it was pre-pandemic, and that's partly contributed to by the fact that the independent sector has been doing growing levels of activity over that period of time.
Not everyone views the situation so positively. A new survey of NHS leads shared exclusively with Newsnight by the Royal College of Ophthalmologists shows around 80% of NHS clinical leads in England think independent sector providers are having an impact on services in their NHS department. Of those, more than 2/3 think the impact has been negative. Only 5% thought it was positive.
I'm very concerned. We're doing some very straightforward, mild cataracts, and everybody's delighted, except that the consultants that are doing that and the money that's being paid for that and the nurses that are assisting with that are not in the NHS, and that money has to come from somewhere, the staff has to come from somewhere, so it's exacerbating other waits, and the other waits are much more important. We know that people on waiting lists to be seen in outpatient clinics are much more at risk of going blind than new patients with minimal cataract. We've prioritised whatever makes a profit, not whatever needs to be done most.
The Independent Healthcare Provider Network says they don't recognise that argument. In the Royal College's survey, the two most commonly referenced problems were training and funding. NHS England says all providers are required to help provide training, but with fewer simple cataract operations in the NHS, some argue there have been reduced opportunities to train the next generation of surgeons, and funding for the work lost can no longer be used to offset more complex operations.
So when the cataract operation in the NHS makes a profit, it doesn't go to people who own the companies or shareholders. What that goes to is offsetting the loss made by, for example, a maternity unit or an A&E department or whatever bits of the NHS is costing more to run. It's a loss of money and expertise to the independent sector that's not prioritised appropriately as it would be within the NHS.
Now we can look more closely at how much money has been given to the private sector as part of this shift. Independent companies are paid according to the operations they carry out, with different patient complexities translated into different codes, like these. More complex, represented by the codes at the top here, have meant a higher fee. Newsnight has been given FOI data from 35 integrated care boards across England by the Centre for Health and the Public Interest. It shows that over 6 years there was a huge growth in operations coded as the most complex, those with the biggest financial reward. And while the number of complex operations in the NHS has remained relatively stable, it's private providers which have driven the increase, registering more complex operations both in real terms and as a proportion of their work. The NHS has previously been clear this increase can't be explained by patients becoming more complex over time. For some, this raises questions over whether so-called upcoding, recording artificially complex codes, could be taking place.
There are a couple of red flags in the data that you gave me. The first one is that the complexity is increasing over time, and we don't have any good reason for that to be the case. The second one is that the complexity increase seems to be predominantly in the private sector, and that is also something that needs to be looked at. It's counterintuitive to me because the NHS traditionally takes the more difficult cases.
Without individual patient records, we can't be certain. It could simply be that private providers are just more diligent in accurately recording patient comorbidities, things like diabetes, carefully following the NHS framework to entitle them to register more complex codes. However, the CHPI suggests that had private providers made the same proportion of their income from the most complex cataract codes as the NHS, then that would have saved taxpayers £29 million in just 2 years.
I think that somebody needs to do an audit to check that the complexity is being applied correctly. It is possible that it is, But there's also a possibility that things are being exaggerated.
It seems strange if you're a believer in free market economics and competition that we're actually paying more for what may well be the same thing but just coded perhaps more accurately.
How do you see the future of ophthalmology?
It's very uncertain. We've seen what's happened in dentistry, and I work in Great Yarmouth. We're in a dental desert. There's very minimal access to NHS care, and I could see that happening in ophthalmology. When the money reduces, the private companies are saying, well, not making enough profit. The NHS has more or less collapsed because everybody's moved for higher wages into the independent sector, and they say, right, well, we're not going to do NHS cataracts, we're losing money on them, and they stop. There's no provision at all. People have to pay to go privately, or they end up with loss of vision.
Representatives from the private sector suggest this comparison to dentistry is misleading.
Actually, what's going on in ophthalmology is that more patients are getting access to NHS-funded ophthalmology care. That's fundamentally a good thing. And generally speaking, the public is entirely relaxed about who provides their NHS-funded care, providing it's high quality and free at the point of use. So we would push back robustly on the assertion that what is happening in ophthalmology, which we think is a major success story, is in any way analogous to what we're seeing in NHS dentistry at the moment.
NHS England told us no one was available for an interview, but it recently consulted on amending prices for cataract operations to reduce the difference between high and low complexity procedures. They add prices are constantly reviewed to ensure they're at a fair price for taxpayers.